Hello. I hope that you had a enjoyable, good weekend, and I was thrilled to be able to get out and vote this weekend. Obviously, you know, New Jersey voting laws changed last year, and early voting happens till the 31st of October, and then obviously Election Day is November 2nd. Great news on the vaccine front. Both Pfizer and Moderna and now J&J have all said authorization for boosters is available. So we are thrilled at that great news, because now we are all clear that the Pfizer, the Moderna, those operate under the same sort of rules, and you can see those up front. With the J&J booster, they're actually recommending that within 2 months, you should go ahead and get that right away. You may have heard as well that there is the ability to mix and match. So if you go to a site and they don't have one of them, they can give you the other, but obviously it's up to you and your physician whether or not you wanted to take that. Our sites remain open and ready, and we're glad to provide that vaccine to you. There is something now they're calling the potential of a twin-demic, as if we didn't have enough demics going on. The twin-demic is when the flu and COVID coincide, and so we're really doing a big push this year for flu shots. Not that we don't always, but we're actually encouraging people to make sure they get them as early as possible, because the experts are telling us that the flu season is going to be upon us and is going to be fast and furious. So we have lots of acknowledgments this week, and all of them are related to what we were just talking about, because they can all be exacerbated or have challenge based on COVID and of course of the flu. So our respiratory team is being honored this week across the country, all respiratory teams, and obviously we know how important they were during COVID to make sure we had those rapid teams, rapid response teams, and also helping with all of the treatment modalities. In addition, Lung Health Day is October 27th, which is very important during COVID, making sure that we're paying attention to our lung capacity. In addition, on the 29th is World Stroke Day, and I am thrilled to tell you that we have received special accreditation from our national accrediting bodies as being a primary stroke center, and we also have received a special recognition from the American Heart Association of using all of the latest evidence-based practices and really implementing at the gold standard level. And so I want to shout out to the entire campuses for all your work on that primary stroke designation. I know that takes a lot for the teams to be able to put together, and especially for the special recognition out of Vineland. Lastly, as we round out October, just an affirmation of the National Physical Therapy Month this week, and I want to share a story of one of our patients, Kevin Flame, who came to us seeking the COVID long hauler treatment program. Even though he was treated at another location for COVID in 2020, he found himself in ICU for 20 days. He then had to go to post-acute, and he still just didn't feel like he was being able to live his full life. And so he showed up at Inspira's door. What happened is the team customized a specific program for him. With his speech therapist, he worked on his breathing and really having increased capacity. With his physical therapist, he got stronger and stronger. And I'm so grateful to the folks at Inspira who have created this plan. We offer it out of Mullica Hill and at Vineland, and really working with the patient to identify their unique needs. This is not a cookie cutter. If COVID hasn't taught us anything, it really impacts different people in different ways. So our programs are going to have to be responsive in that way and be able to meet you where you are and be able to be customized for you. And so a huge shout out to our teams who are working so hard, and to Kevin for thanking him for sharing his story and making others aware of this important treatment. So obviously this Sunday is Halloween, and while I already have seen some early trick-or-treaters practicing in my development, it is so important to make sure that we are all aware of the safety requirements. Safety obviously in the basic level, making sure that your candy is protected and that whatever you're handing out is in single serving conditions, and that people have that available to them. But also just in reference to the it's getting darker earlier, and making sure you're watching for those children and just being alert. Please make sure you have those flashlights ready, because it does get dark early. Until we meet again, be well and stay safe.